is also very difficult.
Yeah.
And I must admit that in a busy practice, sexual medicine needs a lot of time.
That's true.
And you can't do it without a psychologist or psychotherapist or counselor being with you,
That's true.
because they will not open up in a half an hour consult even. It has to be hours. You need to have that intimacy, that relationship. So I have also treated many ladies who come to me. They've been married to homosexual men, bisexual men, and they don't want a divorce or anything of that sort. All they want is to have a baby
Baby.
through IUI, and that seals their marriage and relationship.
Oh,
So, knowing fully well, and these are celebrities of all strata, you see women married to men who are gay. And these men get married due to family and societal pressure. I mean, what drives them to marry a girl when they know that?
they won't have a consummated or a good marriage.
Absolutely. So they will go and have sex outside marriage with their male partners, but here is a wife who sits at home, and then all she thinks of is, if I have a baby, I'll be happy.
I'll be happy. I'll be busy. I'll be happy.
So I think we have to go a long way, and I'm just so happy with the Supreme Court ruling on the transgender population. We saw a lot of gay men who could not admit that they were gay and are now slowly coming out.
Wow.
So many who were transgenders but just could not admit to their parents about their feelings. So leave alone friends or family, and they just continue to toe the line. You could only make out because they would have a fetish to dress up as a female, and then you would know that something somewhere doesn't click right.
That's true. So, ma'am, if we have to give a message to people who are, I would say women, who are struggling with sexual dysfunction, mainly vaginismus or low
Yes.
sex drive,
Yes.
what would be your message to them?
So I think the first and foremost is that vaginismus is 90% a psychological issue, only 10% or even less a tight hymen or some kind of an anatomical issue. So a lot of women think that a surgery will cure them. They come to me saying, okay, can you open up my vagina?
Yeah.
And I tell them, see, your vagina is so open, it's just as normal as it can be. And then they say, no, but it hurts. And so then you have to go into the causes of what makes them have a vaginismus. Then again, a lot of the time, the women is always trying to come more to a doctor to seek help because there's something wrong with the relationship that is causing her the vaginismus.
That's true.
They may even be men with erectile dysfunction, and many women have owned up, if he tries to put a limp penis in, it would hurt, wouldn't
would
it,
hurt.
doctor?
Of course.
And I'd say, yes, of course. So the men will not seek treatment, but the women somehow, if they connect to you,
Yeah.
will come to you with all these problems.
Right, right.
So I think our sexual medicine is treated mainly by quacks, and this is the most painful part because there are no allopathic doctors that they can turn to, but there are thousands of quacks
Yeah.
who will treat them behind a curtain with all kinds of ointments, Ayurvedic treatment. I don't know how much of it works, but
I'm sure, I mean, not to give a number, but yes, we all know that these things, sexual dysfunction especially, I would not call them dysfunctions, obviously, because they are not something which cannot be treated or which cannot be
Yes,
reversed.
yes.
So sexual concerns cannot be treated until and unless both mind and body is worked
is
on.
in union.
And
Yes.
I would want you to give that number to whether it's a male sexual concern or a female sexual concern. If you can throw that light, how much do you think percentage is related to mind and how much related to the body?
Oh, I think majority of it is related to the mind. I think there are relationship issues that are deep down expressed as non-consummation, vaginismus, erectile dysfunction. And once they need to see a marriage counselor before they come to correct their sexual problems, because half of these things can be corrected if they come on the same page mentally. They're
Absolutely.
usually on different levels
Tantrums.
mentally.
Yeah. And I'm sure a lot of these cases finally end up into infertility.
Yes, I think they just brush everything under the carpet, have a baby or two,
Yeah.
and then they're busy with their lives. I
Yeah,
think
yeah.
that's how it works. I feel also, and I want to give this message very strongly, we need to have an online platform for sexual engagement and women and men for sexual conversation, because that is where they turn to. They go to the internet instead of going to see a therapist.
Very true.
They want it anonymous.
Anonymous, they want it private.
Private.
I mean, a lot of patients have come up to us. They say that I don't want to be seen around a sexologist clinic.
Yes, yes.
So I don't want to be tagged as somebody who's having sexual dysfunction. Although we try to tell them that this is not something abnormal. Anybody who's having a tummy ache, who's having a heartache, can have a sexual dysfunction too. But yes, they do need their privacy, their the not to be seen
Who
around.
was that? In Karol Bagh, Delhi, there were these big posters of the Hakim, somebody
Yeah,
who
yeah.
was supposed to be the master of treating sexual dysfunction.
Yes, that's true. And that's true. And that is where we need to, I think, educate people that you need to find the right help.
Yes.
And rather than just.
Also, there are very few right helps available.
That's true.
That is our problem. There are very few doctors interested in sexual health. And I must tell you, a friend of mine, a very successful gynecologist, wanted just to do sexual health. And she said she just couldn't handle it after a time. She gave it a year's practice. And then she said it was so frustrating because they talk for hours and we both get nowhere.
Yeah.
I
can understand.
Session after session, we get nowhere, and they just come and unload their frustration on me.
Yeah.
And they're not even ready to do any exercises, experiment, do anything. No.
Yeah. So, because you rightly mentioned that this is a field which combines a psychotherapist and a doctor so that they can work together.
Yes.
And I mean, I can understand it can be very frustrating for a doctor to do a job of a psychotherapy because I mean, they're not
Absolutely.
equipped for that, and
Yes.
they're not meant for that. They are meant for the
Yes.
clinical reasons where they can tell this is wrong, this is right for your body. But psychotherapist has to do the job of the
But
psychotherapist.
I think your concept of going to the school is highly important. I think I recently saw this movie and I'd urge all our
Yeah.
teenagers to go and see Oh My God too, because I thought such a powerful message for teenagers in that movie.
Yeah.
We need to educate our school going children. They have no kind of sex education neither at home nor at school.
Because you've touched that point, and I won't take much of your time. Last thing, and of course, would make it open for you if you want to add something to it. The recent school which we went and gave this course to, the teachers were like, we've never talked to even our kids about hygiene.
Yes.
We never knew that boys have to pull their prepuce back and wash. So we have
Absolutely.
the course. I would send that course to you, ma'am.
Please.
In the course which we have created under the supervision of Dr. Sangeeta Saxena, we have very beautifully, in an animated form, we have shown that there are different kinds of penis for a boy, and you have a foreskin which you need to pull down every day and wash with warm water.
You know, when we treat male infertility and we want to collect a semen sample, we always get loads of bacterial contamination.
I'm sure.
And then we tell them, please, here's a bottle of water, here's some cotton swabs. We want you to clean thoroughly before you collect the sample. But it's so hard to teach them
They don't know how
without
to clean it.
animation,
Yeah.
because how much do they pull back? How do they clean?
Yeah. Yeah.
So
yeah.
it has to be taught in school.
Yes.
Has to be taught in school.
Thank you so much, ma'am, for that. I would say that reassurance that yes, we are at the right step, we are at the right way. Thank you so much, ma'am.